what person-centered counselling is. Today we'll explore what person-centered counselling is and how this approach understands the role of the therapeutic relationship in change. Person-centered counselling is most closely associated with the work of Carl Rogers, an American psychologist whose ideas had a significant influence on the modern counselling and psychotherapy. Rogers developed this approach in the mid-20th century as an alternative to more directive or expert-led models of therapy that were common at the time. At the heart of person-centered is a simple but far-reaching idea. Rogers believed that people have an inherent capacity to move towards growth and psychological well-being when the right conditions are present. Counselling, from this perspective, is not about fixing, correcting, or directing someone. It is about creating a relational environment that allows this natural capacity to emerge. In person-centered counselling, the therapist's primary task is not to analyze or interpret experience. Instead, the therapist focuses on providing specific relational qualities. These include empathy, which involves understanding another person's experience from their point of view, and genuineness, which refers to the therapist being real and transparent rather than adopting a professional mask. There is also an emphasis on acceptance, meaning the client is not judged or evaluated within the session. These qualities are not techniques, they are ways of being in the relationship. Person-centered counselling assumes that when these conditions are consistently present, people are more able to explore their thoughts and feelings openly and develop greater clarity about themselves. Unlike CBT, which we discussed in a previous episode, person-centered counselling does not usually involve structured frameworks or specific methods for examining thoughts or behaviours. The focus is less on identifying patterns and more on supporting the client's own process of exploration. The direction of the session is led by what feels most important to the client in that moment. This does not mean person-centered counselling lacks structure. The structure comes from the relationship itself and from the therapist's commitment to maintaining those core conditions throughout the work. Over time, this consistency helps clients develop greater self-understanding and trust in their own experience. One of the distinctive features of person-centered counselling is its view of expertise. In this approach, the client is seen as the expert on their own life. The therapist brings professional knowledge about the counselling process, but does not position themselves as the authority on what the client should think or do. This shift in power was one of Rogers' most influential contributions to counselling practice. Person-centered counselling is often described as non-directive. This means the therapist does not guide the client towards particular conclusions or outcomes. Instead, they support the client in discovering their own meanings and directions. For some people, this feels very freeing and respectful. For others, it can feel unfamiliar if they expect therapy to involve advice or guidance. When compared with other approaches, person-centered places less emphasis on diagnosis, technique, or intervention. Psychodynamic approaches may explore unconscious patterns and early relationships in more depth. CBT may focus more explicitly on changing thinking and behavior. Person-centered differs in that it prioritizes the quality of the therapeutic relationship as the main vehicle for change. This does not mean it is passive or unfocused. Oh, no. It is an intentional approach grounded in a clear philosophy about human growth. Its impact often comes from the experience of being understood and accepted without condition, which can support meaningful shifts over time. Understanding person-centered counselling helps clarify why different therapeutic approaches can feel very different, even when they share the same setting. Each approach carries assumptions about what helps people change and what role the therapist should play. In the next episode, we'll explore what psychodynamic counselling is and how it approaches understanding experience through patterns, relationships, and the influence of the past. That's the scope of this episode. Each episode focuses on one specific element, and this was it. We'll leave it here for now and move on in the next episode.